Today's video is all about recent DHA exam MCQs, so stay connected and watch this video till end. And note down all these important points. Also make sure to subscribe this channel and click on the bell icon. Exam MCQs related topics: 2-point gate, 4-point gate, milestones. As I always mention that milestones are very important. Lead pipe rigidity, cogwheel rigidity, Bennett's fracture, hip range of motion, dystopia definition, Ebb's palsy, Chino recurvature picture, Q-angle picture, muscle involved in tennis elbow, radial nerve compression, muscle fiber picture, muscle involved in first order liver, Q-angle, Achilles fracture, Monteggia fracture, radial nerve injury, alkalosis and acidosis, tricuspid valve, neuropraxia, Moro reflex. Reflexes, pediatric reflexes are very important. Pain gate theory, diplegic gait, Brown-Scott syndrome, GCS, homonymous hemianopia, movement occur at sagittal plane, Brody's abscess, capsular pattern of hip. How many tender points are needed to confirm fibromyalgia? 4, 2 or 11? So the correct option for this is 11. What's the aim of treatment in acute respiratory distress syndrome? Which type of exercise maintain length throughout contraction? Delayed relaxation after contraction in which disease? Lower lobe atelectasis. Position for breathing should be. The answer is sitting with 45-degree backrest. So this is all for today. Thank you for watching this video.